Eva Pius. She is a home health LVN, and she will be coming on today to teach us a little bit more about her field. Thank you.
Thank you for having me.
No problem. Thank you for meeting with us today. So, Eva, you are a LVN, correct?
Yes.
And how long have you been working as an LVN?
For a little over a year now.
Mm-hmm. So today I'm hoping to get a little bit more insight on what you do in your field and your thoughts on your field and the things that you are passionate about in your field, and to learn about what it takes to be a part of the field that you're in. Because for me, I'm doing something a little different than what your major would be. So to me, I think it'd be interesting to find out, something different from what I would do. So what is your process of becoming an LVN? Like, what schooling and things like that did it take for you to become where you are today?
Well, to be an LVN, you have to go to school, just like most other professions these days.
Mm-hmm.
So for LVN, it's usually about a 13-month program. It's pretty fast-tracked, like everything's done very quickly. All those classes are stacked on top of each other. I went to Concord Career College in San Bernardino, and it was a 13-month program, about $30,000 for the whole program. We had part class time, part clinical time, so we were in class doing paperwork and obviously, learning the curriculum and everything, and then we would take that to the clinical site. We would actually go to a hospital or a nursing home and put into practice what we've learned in the classroom.
So more hands-on.
Exactly. Yeah, you follow another nurse and you learn from them, and so you get to be in it.
Working in home health now as an LVN, what is your daily routine then?
Well, I get up and I get ready, and then I go to work. It's it's at someone's home, so I go and I have to go into their home, and sometimes it's a little weird at first when you get a new patient.
Yeah.
It's kind of uncomfortable. You never really know what you're gonna expect. You don't know what to expect. But no, I go there, and then I just like anywhere else, whether you were in the hospital, if you're in the nursing home, home care, I take my patients' vitals, and I do a assessment every morning to make sure everything's okay, everything's still normal, and I just proceed with the daily care for my patient, whatever their specifications might be.
Yeah, according to whichever patient. Now, what is some of the pros and cons of your job, or maybe some of the biggest rewards that you feel working in this field, and some of the struggles that you feel working as an LVN?
For me, being an LVN is very rewarding. I enjoy what I do. I love it, and I always love my patients, and I care for them and their families. So just being able to help them alone feels good. It's nice to just be able to go and take care of somebody and make their lives a little easier, because they're going through something really hard. They're very sick, and to be able to make an impact on that, and a lot of times in my situation for their families too, because I'm around their whole family.
Yeah.
So I can help the patient, I can help their family, and it's nice. But another thing about being around them and their family is there's a lot of outside stress, that you don't always get in other situations. I deal with everything that the family deals with every day too. It's almost like you're a part of that family, and so you kind of start to feel the pressure of their own problems. You know what I mean? So you have your whole life, and then you have their lives, and it all kind of impacts you.
You
too.
get kind of smashed in.
Yeah, you start to really, I guess you attach yourself almost kind of to the family, and so you feel a lot of the pressures of the family. And sometimes it can get a little, just a little, a lot. It becomes a lot. And sometimes you have family members you don't necessarily get along with well.
Yeah.
And sometimes that doesn't end too well either. So you just have to be careful.
A balancing act.
Yeah, a balance. But I think in the end, the good outweighs the bad.
Yeah. So what inspired you to choose this field?
I've always really enjoyed science. I love science, and especially human science and biology and everything like that. I love anatomy and physiology has always been my strong suit, and so I wanted to pursue something that would keep me always in that, always dealing with those same concepts, and so I really enjoyed the schooling. For me, it was fun, I got to learn about things that I really enjoyed learning about, and I did well with it, and and now every day I still get to do that. So
it's awesome.
It works out.
So, what are some common misconceptions that you feel people may have about LVN?
I think the most common misconception is just that a nurse's job is easy. Excuse me. And I think by any means, no matter what field you're working, whether you're working in a hospital, whether you're working at home, I think it's anything but easy. You know, I feel like nurses have a lot of pressure, and people seem to overlook that. You know, they just expect it of you to be fine and to deal with everything. I think people underestimate just how much you really do and how much work it is and stress and everything, especially with home health, because it's looked as very low tier.
Yeah.
You know, and because people think, oh, okay, well, you're just at home relaxing, you know, but it isn't like that. I mean, you're the only person on shift, so when something happens, you're all you have to. You're the only person there, so you have no one to look for help. It's just you, and you have to assess the situation and handle it as needed. And I've had times where I've had to do that, you know, and I feel like it's made me stronger as a nurse, but people don't think about that, you know. They think I just sit around.
Okay, right now you're working in the home field. So do you think that you have more a closer relationship to the family than nurses working in other types of fields? And is home health what you want to continue to be in that field? And if not, do you think you'll miss being able to be that close in the family dynamics, or do you think that it may be kind of a relief?
Well, I definitely think you're a lot closer to the families in home health versus any other situation, really, because even in nursing homes, even though the family may come visit a lot, you still only see them for maybe a couple hours, you know, and that's whenever they visit. So whereas what I do, I see this family for 40 hours a week, every single week, you know, and I'm just spending time with all of them, you know, any brothers or sisters that my patient has, or any other relatives that they have, that their whole family comes over. You really start to get to know their family and become very intertwined with them in a way, and you don't get that insight like you do in home health anywhere else, you know, because you are watching everything this family does. So you really get to know them and how they are and everything. You know, you get to know stuff you shouldn't even know, you know what I mean? Because you're just there, so it's like things happen and there you are. But I love what I do, and I appreciate every opportunity I've been given through home health, but I do want to move forward from that. At some point, my ideal goal is to be a correctional nurse. That's what I started this for, and that's what I'm working towards, trying to get my experience for. I wouldn't say I miss it, because they're just two different worlds, and it's to be expected, you know, and it's 100% different in every aspect almost, you know, like, and so I'd probably just miss in general what I did before I would miss my patients and family and all of it, but at the same time I would be doing another job that I also really love.
So you mentioned that right now you are working in home health, but you do want to work in the prison as a correctional nurse. What are some other areas of growth in your position as an LVN? What are some types of jobs that you could do? I know you mentioned home health and to work in the prisons. Is there any other type of places that you can work, and what's the growth in this field? Can you continue schooling and, you know, build upon that?
There's almost endless opportunities as far as nursing goes. You can be a case manager, you can hospitals, nursing homes, home health, prisons, like sheriff's offices, schools, you know, there's so many different ways you can go, which is why it is really such a good career path, because if you don't like one thing, you can try another. If you don't like that, you can try another, and it almost goes on endlessly, you know. And one time I even saw an opportunity for a coroner's assistant, and like my qualifications, I qualified for that job. So even stuff that you wouldn't think, like not even really the nursing title, but your schooling will qualify you for. So there's other stuff you can branch out to. And then if you've exhausted your LVN options, or you just want to move up, you can become an RN. They have a lot of bridge programs. It's cool that there's so many different branches.
Yeah, because it allows you to have a lot of growth in that area. Now, what advice would you give others to other people who are interested in pursuing a career in nursing, or who may be just kind of interested in that? What advice could you give those people?
You have to be strong you're tested early on, through the school. When you're in school, it's not easy because there's a lot of emotion in it, and there's a lot of gross stuff in it. You also have to be very comfortable with bodily functions. That's something super important that I think some people underestimate themselves on too, is you really have to be okay with everything and lots of bad smells.
So, which was interesting that I learned from this interview, like you were saying, is nursing has so many endless options, and I really thought before conducting this interview, if somebody was to say being I want to go into the field of being an English teacher, and you're in the field of nursing, and you would kind of think that they're so different, but there is so many differences and similarities, and I think that's really interesting, and I've learned a lot through that. Because one of my questions I have for you was, could you imagine working in a field in something like that I do, kind of on the opposite side of the spectrum? But it seems like almost you have those options available to you. So maybe even somebody who is not maybe thinking of nursing as their first choice, can now see that there's endless options.
Well, and what's interesting too, though, the bridge between teacher and nurse.
Mm-hmm.
What's cool is that nurses teach a lot too.
Yeah.
And that was actually something they really stressed in school. Is you're a teacher because you're teaching all the time. If your patient is newly diagnosed with diabetes, you have to teach them about blood sugar and about how to take it and about how to properly administer their own medication, because it's a whole new thing in their life. They're not familiar with this whatsoever. So you have to teach in a way that makes sense to them, because I can't just be coming out here and saying, all these big words, and stuff, and then be like, okay, good luck, buddy, and and they're not going to know what to do. So you have to be good at teaching people and helping them understand how to live with their disease. There's a lot of teaching that you do every day too, or even when I get a new patient and one of their family members is taking care of them, and I can teach them how to better take care of their family member, So it does integrate, I think, a lot more than you would think,
Yeah. Well, thank you for sitting down with us. I feel like I learned so many new things and kind of amazed by all the things that you do. And I wish you the best luck in your field, and I hope you continue to grow. Thank you for coming on.
Thank you so much. Thank you for having me. I appreciate it.